Here's another select all that apply question. The nurse has performed the following activities during the shift. Which activities are violations of client privacy and/or confidentiality? Select all that apply. A. Discussing the client's HIV status over lunch with a friend, a nurse on another team located on the same nursing unit. B. Answering questions from a client's visitor before verifying the visitor has permission to receive the information. C. Removing a printed report of a client from the hospital premises to write a case study for a staff meeting. D. Responding to the client's questions about the plan of care with a visitor present in the room. Or E. Leaving the mobile computer screen, which contains client information, open when a visitor asks questions. And we'll give you a minute to think about this one, and we'll come back. Okay, let's come back to this question. Okay, and the correct answers are A, B, C, and E. Okay, now we're talking about HIPAA laws, privacy confidentiality laws. You have to pick out which of these activities are violations of the HIPAA laws or confidentiality laws. And they are all violations except for D. So A, discussing the client's HIV status over lunch with a friend, even if they're a nurse, is not permitted. That's sharing information with someone who doesn't need that information. That nurse is not on the healthcare team for that client. So that is a violation of HIPAA laws. B, answering questions from a client's visitor before verifying the visitor has permission to receive the information. So when you're speaking with clients, visitors, family, friends, you must verify that they have permission or consent to receive this information about your client. So that's a violation of HIPAA laws. C, removing a printed report of a client from the hospital premises to write a case study for a staff meeting is also a violation of HIPAA laws. We as nurses are not permitted to remove any written documents on the client information from the hospital premises for any reason whatsoever. And if you are in the clinical setting in a hospital, whatever type of hospital, you are not permitted to leave with any of that client information. So be careful, especially if the nurse that you may be working with a nurse and that nurse is nice enough to print out information for you to complete your care plan or your documentation, whatever is required from your nursing school. You have to be very careful, and you have to put that information into the shred bin or whatever the hospital uses before you leave the hospital. You cannot take that paperwork with you when you leave the hospital. So be very careful about that. Be very careful too, if you have that information in your pocket, if you have it folded up in your pocket, be very careful. Keep that with you. Please do not drop that information on the floor. I've seen this happen. Private, confidential information, it's dropped on the floor, and then someone comes behind the student and sees that information on the floor. And not only the student, but the university can get into trouble for that. Okay. The last one that is a violation is E, leaving the mobile computer screen which contains client information open when a visitor asks questions. So you have to, anytime even as a student, especially as a nurse, you have to be very careful with your computer screen. It's going to have a password, but it may not go to the password right away. So you have to be sure that your monitor is turned off when you're around clients or other people, other visitors in the hospital. Okay, so that they are not able to see that private information about your clients. So letter D, responding to the client's questions about the plan of care with a visitor present in the room. Yes, that's permitted. That is considered informed consent. I'm sorry, implied consent. That is considered implied consent. When there is a patient in the room and the visitor is with them, that is implied that the patient has given consent for them to hear the information that is being shared between the nurse and the client. Okay, implied consent. And that's it for this one. Hope you enjoyed it. If you like these test questions or this practice or my content, please consider liking, sharing, and subscribing to my YouTube channel, Nursing with Heart PhD. See you on the next one.